And we just want to say thank you so much for letting us present today and come on out. We're really excited to be the second Tech Wednesday. It's a lot of pressure to follow the first Tech Wednesday. But we are really looking forward to showing you how we are leveraging data analytics to connect with our members and why we opened our Prominence Care Centers in 2019. So without further ado, I'll share my screen and we'll turn it over to our VP of Information Technology, Mr. Eric Rasmussen, who, might I add, was selected as the Technologist of the Year, and we look forward to celebrating virtually with you all here coming up soon.
Awesome. Thank you, Amy. And thank you, Dave, and thank all of you for attending today. This is actually quite an honor and a pleasure for Prominence to be able to host one of these sessions. So looking forward to exciting you with healthcare. So why don't we, Amy, if you could just take us to the next slide, please. So we'll start with a little bit about Prominence. Home means Nevada to us. So headquartered in Reno, Prominence is called Nevada our home for 27 years. You probably, for some of you folks that have been around town for a long time, we were originally St. Mary's Health Plan, and then we were purchased by, I think it was Dignity. And then UHSS came in and purchased us. So we've actually been around for quite some time. We are locals living in the same community as our members. We provide providing innovative healthcare solutions, taking a proactive approach in managing care. And this is what actually I think brought a number of us to Prominence, this second point here. We have a very progressive CEO of Prominence, and he is not afraid to look at new technologies. And we're going to talk to you about a few of those as we go through the presentation today. And then we've been pretty successful. We actually added over 5,000 Medicare Advantage members in 2020 so far. And to put that in perspective, if I did the math correctly earlier, that's well over a 50% increase in our membership. So we're doing something right. Next slide, please. For more than 25 years, Prominence Health Plan has been keeping families, businesses, and communities in Nevada and Texas, we also cover Texas, healthy by providing health service excellence and quality care to those we serve. We offer a spectrum of products, including employer-sponsored commercial health plans, fully insured administrative services through Prominence Healthcare Solutions, and a Medicare Advantage plan. Our Prominence Care's approach is more than just a catchphrase, though. It's a way of thinking that is at the very core of all we do. We realize how many people depend on us for innovative care and the strength we offer in personal, local relationships. Our values ensure compassionate, high-quality, affordable health services and focus on building connections with the members, providers, and businesses we partner with. We put accessible healthcare at the forefront of communities by providing a robust hospital network and unparalleled resources to our members. Through our Prominence Care Centers, Medicare Advantage members and select commercial groups have access to primary care and a full-time medical team and health coaches who are dedicated to helping members get healthy, manage their health care, and achieve their ultimate well-being. Prominence Health Plan is a subsidiary of Universal Health Services. Hopefully some of you have heard of them. They're a relatively small company, part of the Fortune 500 group. We're one of the nation's largest and most respected providers of hospitals and healthcare services. In 2019, UHS was again recognized as one of the world's most admired companies by Fortune, ranked number 293 on the Fortune 500, and in 2017 listed as at 275 in the Forbes inaugural ranking of America's top 500 public companies. So we actually have the financial backing to really do some cool stuff, which we have been doing over the years. So I covered some of these things in the opening statement. just some of the specifics: 27 acute care hospitals across the country, 320 plus behavioral health facilities. I think we're the largest behavioral health provider in the country. We are member-centric, so care should be accessible, high quality, and affordable. If you look at how we've designed our products, the Care Centers is a great example. It's all geared around making care accessible, easy for people to get to, where they need it and when they need it. And we also have built our organization around the member experience. Some of you who may have Prominence, hopefully, may have experienced our resolution team. We're all about that single point of contact, being able to make that one phone call, first call resolution for whatever your situation may be. But we really have, and I think Dr. Biondi might talk a little bit about it as we get into the care centers, we really have focused on the member and ensuring that we know what their health situation is so that we're better prepared when they come into the care center to address whatever it is that they're coming in for. And then value-driven partnerships. So partnered with Vera Whole Health, which is Prominence Care Centers. We also partnered with REMSA for our nurse line. And some of you may not be aware, but we did actually win an NCET award in 2019 for our use of Teladoc. And so Teladoc makes access to doctors and medical care available to folks 24/7 by a phone call. And I actually shared an example when I got to accept the award on behalf of Prominence at the dinner, which was really great, Dave, by the way. It was a great event. And I shared a story about my daughter who typically when they get sore throats, for those of you with kids, you know the drill. You have to go into a doctor, you have to make an appointment, then you have to sit there and wait, and then you have to go get your prescription drug. And before it's all said and done, you've burned a half day. Well, within, I'd say, 10 minutes, Teladoc had diagnosed what was wrong with my daughter, and we ran down and got the prescription, and it all happened within about a half hour. So it was just fantastic. Anyway, that's a little bit about Prominence to get us started. Why don't we move to the next speaker? And I believe that would be, is that you, Dominic, or is that you?
Yeah, it is.
Great, thank you.
It is. Yeah, thanks, Eric, and thanks for unmuting me there, Dave. Appreciate that. So hi, everyone. My name is Dominic Enriquez. I'm the Vice President of our Performance Improvement Team. We worry about things like quality, outcomes, good patient care. Even as a health insurance company, there's a lot that we can do and do to influence the overall outcome and quality of care that our membership receives. So kind of segueing a little bit from, who is Prominence to getting a little closer to why did we build these care centers and what's going on inside of them that's so interesting. Just a quick word about population health and managed care. So really, if you think about it, this is just breaking down kind of what we are in the healthcare industry. We as the insurer and as a managed care company, we do well when our members secure insurance with us, and then hopefully don't get too sick, right? So we're always trying to manage outcomes and the health of the overall population that we cover, with the goal of mitigating unnecessary utilization. We don't want people to be going into the hospital for things that could have been managed at home or through, lower acute settings, something like primary care. So when we look at, what we're doing in population health management, we're really trying to use all of the information and tools at the disposal of the health plan. And I will say we sit on a lot of data, and we have to leverage that effectively and make some calls around how to manage, right? We may see in our data that there's, excuse me there. If you're not on mute, please go on mute. So, some of the things that we're doing is we're looking at our claims data and we're finding out which members need a little extra care, a little extra help. We see people that are going to the hospital that shouldn't be. Do they have a primary care provider? Do we need to give someone a phone call and pair them up with a primary care provider? Is there an access issue? Do they have trouble affording their medications? So high level, again, it is in our best interest financially as well as ethically to use tools at the health plan to drive quality outcomes and to lower costs. I think everyone knows we've got a big healthcare spend problem in this country, so we all have to do our part to kind of pair resources effectively, especially in a state like Nevada where we do have some access problems. We'll go to the next slide here. So kind of how do we do that at Prominence? Well, again, we've mentioned that we're very member-centric. I think this slide highlights that. And then sitting around the member are various resources, teams of clinical and non-clinical folks at the health plan that can reach in and help. They can do things to sort of accomplish the goals that were mentioned previously. So we have teams of individuals that do nothing but call our members. They work down lists that are driven by some of the analysis that we do. And again, they're trying to identify those people that need preventive care, need a wellness exam, need a primary care visit, et cetera. We are very careful about the network of primary care and specialist providers that we work with. And we share quality performance information with them. Again, that's part of creating a good ecosystem around the member. We have teams of individuals, well, we've got teams of individuals that actually work to build and support the relationships between plan and provider and physician in the community. And we have a team of individuals that's actually using kind of a risk stratification system where we're identifying those that if you think about the 80-20 rule, it applies here. We've got probably 20% of our membership that's making up 80% of the medical cost. Maybe that's a surprising statistic, maybe not, but a lot of those things, the utilization that we see with that 20%, we can manage, we can reduce, we can keep members home, we can keep members out of the emergency room. And then as Eric alluded to, we do have a resolution team that is really aimed around another dimension of quality, which is customer and member experience. Next slide, please. So building upon that, I mentioned health plans sit on a ton of data, and we have quite a bit that we can learn about our membership just by looking at the data. We see diagnosis information, we see procedures and tests that are performed. All of that helps us build somewhat of a profile for, is this a healthy individual? Is this a less healthy individual? But sometimes, especially when we take on new membership, let's say a new employer group signs on to Prominence, or a new member enrolls into a Medicare Advantage plan at the beginning of the new year, we kind of have a data deficit there, and we're struggling to know exactly how we can help or if we need to help. So to supplement sort of lack of data, we do things like surveys. So we administer what we call a HAT survey. It's a health assessment tool. Really, it's a set of survey questions that help us build more profile, build more of an understanding of the risk and the needs of that particular individual. Next slide, please. And we have another kind of process called our continuity of care intervention, and that's really aimed around, again, when new membership comes on, where are some of those things that might fall through the cracks? We know that sometimes when you're changing insurance, you may change providers, you may have to establish with someone else. Sometimes a drug that's covered on one insurance plan may not be covered on another. So we have a lot that we can do there by questionnaires and surveys to make sure that we are fully building a profile that we can then analyze and drive effective intervention around. So that is exactly what we do in the spirit of managed care and population health management. Can we go to the next slide here? So again, I mentioned a little bit of the analysis, but let's just assume that happens and we have good data and we understand who needs what. There still is the question of, okay, so what do we do with that information? It's not enough to know. We have to be part of the solution. Part of what we were finding, unfortunately, in the Northern Nevada region was an access problem. We were finding that some of the necessary services weren't always accessible or affordable. So a big motivating factor beyond sort of running the analytics, understanding our population's needs and knowing what needs to happen, we needed a delivery model that could support all of those needs, those proactive preventive care needs, the care team that can support the existing infrastructure in the market and really lower costs and improve outcomes and patient satisfaction. So that's kind of what brought us to a conversation with an organization called Peripheral Health. And I'll pass the mic at this point over to Chris King to introduce himself and talk a little bit more about the care centers and kind of how they play into this story.
Well, thank you. I like how Dave plays Wizard of Oz in this process by opening up the mic. So yeah, my name is Chris King. I am the Regional Vice President for Vera Whole Health, based right here in Reno. As you can tell, I'm a local boy, born and raised, but actually have lived here, believe it or not, since 1988. So a fairly long time. So yeah, so we opened the Reno and Carson Care Centers in 2019, as Dominic mentioned. And Vera, as a company, we had care centers, a lot of them in the kind of Puget Sound area, had a number of clients, Seattle Children's Hospital, Bill and Melinda Gates Foundation, City of Kirkland, City of Everett, lots of different corporations that we had worked with. Also Amy's Kitchen, which anyone who goes to Whole Foods may know their burritos, but a company based in California, actually Pocatello, Idaho too. So, and our company generally did near-site, on-site care centers, really managing the health of populations. And so again, started this relationship with Prominence to open these care centers. You know, I think we again, are very focused, as Dominic describes, on primary care, on taking care of patients in that setting. Some of the things that we really focus on, patient experience, and you'll see a little bit. I unfortunately, you've got me as your tour guide in some videos we're going to show in a couple of minutes. But we focus on patient experience, patient satisfaction. We survey our patients and use NPS, fairly common methodology that lots of different industries utilize, Net Promoter Score, in order to survey our patients. And then we do personalized care, and we talk a lot. Dominic talks a lot about data, and data through all the claims information that comes on when you see a physician, when you go to the hospital, when you get medications refilled. We're not talking here about the concept of Big Brother, but we're talking about the concept of being able to get information that really tells us a story that ultimately helps our physicians in the care center be able to understand how they effectively manage care based on lots of information that can be provided from all of that data, which significantly helps us customize our care to our patients. And a lot of the care we're going to talk about too is some of the preventative work that we can do to really manage those patients effectively. You can go ahead and move slides, Amy. So again, we'll talk a little bit about, you know, with the preventative care we do. I mean, again, we've always been a sick care system, right, in the US. I mean, in many ways, we spend much more of our time and effort on fixing people. But I think, you know, again, when you hear about value-based care, that's getting back to more preventative care for those people who have chronic disease. And look, disease is very prevalent in our society. How do we manage diabetes better? How do we manage hypertension? How do we deal with depression, a real issue that fortunately we've started to talk about, I think, a lot more as a society. we also are acute care. We're not an urgent care. We're not sort of people just don't show up at our doorstep, but we make sure that we get people access the same day or the next day so that when they need care, they can come and see their doctor in more of a traditional sense. You know, a lot of these days you call your local primary care physician and they say, yeah, we can see you in 6 weeks. Well, usually people want access when they're sick. So if we can get them in and we have the relationship, that's part of what we do at the care center. So it's always this blend of traditional medicine with a lot of information that, again, Prominence can package up. And then other things that we have in the care center. So we have health coaches who can work on lifestyle issues. We have on-site labs, very simple, but you know, how many times have people got a lab slip and have all these great intentions of going to see LabCorp or Quest, and you know, 3 weeks later after you get it out of the washer, you realize your lab slip is still in your pocket and you've never been. That's, you know, some of the things that we can do. The other thing is we have 200 generic medications that we can dispense right in the care center. So again, it allows patients to not have to go somewhere to get that medication. We can hand it to them as they leave. And as basic as that is, it's amazing. You see a lot of data around how many people do not fill their medications, and it causes a lot of impact in total healthcare costs. So again, and then the other thing we do is help patients navigate through the system, coordinating their referrals to specialists, etc. I mean, basic things, but healthcare is complicated. And we deal with a lot of seniors, and seniors, you know, oftentimes are one of our most vulnerable populations. So it's really important that we help coordinate their care too. Hi, my name is Chris King, Regional Vice President of the Prominence Care Center, and I'd like to welcome you to the waiting room area, and we're going to do a little tour. Because of COVID, one of the things we've had to do as we check our patients in is that we have to take their temperature, make sure that they're wearing a mask, and then have them use hand sanitizer in order to keep all of our patients safe. One of the things we think a lot about at the Prominence Care Centers is the look and feel. I think you'll see in terms of the aesthetics of the care center, it's an important part of that patient experience. As we check into the care center, what would normally happen is that one of our staff members would come up, greet the patient, and then we will take them back to the exam room in order to see one of our providers. We have to think a lot about our elderly patients and making sure that we take care of them, even in terms of the chairs that we have. The design of the chairs is such so they're low to the ground, so it's easy for our patients to get into those chairs. And we're going to show you how these chairs work in order for our elderly patients to make it very easy for them to be taken care of. One of the unique things at the Prominence Care Center is that as part of the visit, you can see a health coach. And the health coach is there to work on lifestyle issues. Maybe it's someone who wants to lose some weight. Maybe it's someone who wants to manage their stress better. So we have health coaches that work alongside our providers and allow patients to see them and put a plan in place to work on various behaviors that they want to work through with the coach as part of the experience in the care center. One of the exciting new developments at the care center is that we now have the ability to do COVID testing and get results within 15 minutes. So this machine here is actually a flu test machine, but now we will also be able to do COVID testing. And for patients that are symptomatic, we'll be able within 15 minutes to give them the results to know whether they are positive or negative. One of the other things we provide is vaccinations for our patients so that, again, they can get the flu vaccine, they can get the vaccine for shingles. So we provide vaccinations for our patients. And our philosophy is that it is much better to bring that point of care testing to our patients, to have them get that testing right here in the care center, whether it's labs, whether it's monitoring vascular disease. It's much better if we can do that testing right here, because oftentimes patients will say they're going to do something, but ultimately when they leave here, they may not go do their labs. So that's why it's important we bring those services to our patients in the care center. At the Prominence Care Center, we dispense medications for our patients. We have 200 different generic medications that our providers are able to prescribe at the care center. Again, it provides for convenience, it provides for compliance, and it's a great service for all of our patients. I'm going to hand over to Dr. Biondi.
Dr. Biondi, I think we need to unmute you still.
There, how about now? Better now? Yep. Oh, great. Hi, thank you so much for inviting all of us. I'm Dr. Tracy Biondi. I'm the Interim Chief Medical Officer at Prominence. Very happy to be here. A little bit about my role. I sort of think of myself as helping to build that infrastructure that's needed for accountable care, help to design some of these processes along with all of my team, processes focused on disease management. We try to reduce variation. We want to, of course, improve care and really connect hospitals, physicians, home health care, and extended facilities through business, clinical information, and technology, really. So I wanted to just take a moment and talk about the biometric screening that are offered at the PCC. Typically, when you think about a biometric screening or an assessment, it's really just a clinical screening. We use this to identify and monitor certain health conditions like heart disease, like diabetes. We try to measure some of the physical characteristics, height, weight, BMI or body mass index, blood pressure, blood cholesterol, glucose, and sometimes even fitness tests. We look at these, we try to assess the value against benchmark, and we evaluate some of those changes in health status over time for our members. Go ahead to the next slide. Good, there. So you can see on that slide some of the annual testing that's included in our health assessments. I think it's important to just mention that healthcare costs are often attributed to chronic conditions, and many of those conditions are preventable. Things like heart disease, for example. Proper diet is very, very important in folks with heart disease. Exercise, of course. So we try to identify these things early, identify risk factors. We try to identify blood pressure issues. Diabetes, we know, can be prevented and sometimes managed in a way to prevent larger problems that might occur down the road. And so this is really where biometric screening becomes most beneficial. It's a regular assessment of an individual's health, and it really provides a lot of valuable insight on current health issues and potential medical issues that could occur in the future. So in doing this, we try to identify strategies for improved health and well-being for our members. We can kind of go on to the next slide. So yeah, this is, I get to do the exciting part. Here's some video of some of the great kind of exams and testing that we perform at the PCC. The first one here is a diabetic retinopathy exam. And basically, this is it's a complication that it can occur as a result of diabetes. It causes changes in the blood vessels in the back part of the eye called the retina. And if these changes are not detected, then that can lead to vision loss and even blindness. So you can see that in this video, a photo of the retina is captured in the office and then sent to the ophthalmologist for review. And basically the exam is quick, it's comfortable, and we believe that it's important to watch for signs of diabetic retinopathy in early stages when there are treatments available to preserve vision, and those treatments are most effective. So I think this exam really highlights and informs risk and treatment for our members. We can go ahead and watch that now.
Going to do a diabetic retinal exam using our handheld camera. This is really easy to do while the patients are here in the care center. During real life, the patient will be in a dark room, avoiding any stimulation such as their cell phone for 5 minutes minimum. And then we'll come in and we have our camera here. So I tell the patient that we're gonna test one eye at a time, and we're gonna do your right eye first. So put your hand over your left eye, and we're gonna situate it and tell them to keep their eye real big and open without blinking as much as possible. And then once we get our picture, the camera senses it automatically and automatically takes the picture. So then I tell them, we're gonna move over to your other eye. So put your hand over your right eye, and we do the same thing, getting in nice and close. They're gonna see 2 green dots until they see a big flash when it gets the image at once, and then it's done. And then once the images are captured on this camera, they get sent over to a ophthalmologist for review for any signs of diabetic retinopathy, and those results get sent back to us, and we can notify the patient of the results.
Excellent. Okay, we'll move on. We'll show you this next test. It's a bone density screening. And the next clip is a demonstration of that screening tool for bone density testing. So typically there are really a number of tools that your doctor can use to check on your bone health. Things like physical examination, there are blood tests, urine tests to measure calcium levels, and bone density tests are used to diagnose bone loss. And you may have heard the term osteoporosis or osteopenia. If you're over 45 years old, you may be recommended to go get a bone density test if you've had a broken bone or maybe change in posture, some loss in height. Typically, this particular type of test uses an X-ray to measure how strong your bones are. But this particular tool at the PCC is a screening device and allows for monitoring and diagnosis of osteoporosis and osteopenia. It's very easy to use, and it delivers accurate bone density assessments, and that allows us early prevention and assessment for osteoporosis and osteopenia without any kind of an X-ray. So that minimizes that particular risk. Go ahead and play that now.
We're going to be doing a mini bone density test here today. So first I'm going to do is measure your wrist. So I'm going to ask you to put your elbow here. Perfect. Right there. And then we're going to turn your palm this way. And we're going to keep your arm as straight as possible. And we are going to measure halfway, which will be the part right here, right there. Okay, all done with measuring. Next, I'll ask you to put your wrist comfortably right here where we measured. And I'm going to apply some goo so it might get cold. We're going to take our instrument and spread it around. We're going to start the test. You might hear a couple beeps. So it usually just takes 3 turns. And then we're all done and I can clean you up.
Great. Okay. So we'll move on. Couple more tests to share with you all today. This one is a diabetic peripheral neuropathy assessment. So this particular tool assesses for this condition, and it's considered to be a sural nerve conduction test. The sural nerve is simply a distal sensory nerve. What we know is that it reliably will exhibit some nerve conduction changes in patients that have diabetic peripheral neuropathy. So basically, this test alone doesn't allow a diagnosis or some kind of afford a diagnosis in and of itself of a diabetic peripheral neuropathy. The actual diagnosis is made on the basis of the patient's history, physical exam. There are objective test results. But this sural nerve conduction test is really a quantitative biomarker. It helps to identify those folks with this particular issue when they don't have any signs or symptoms. It can help to confirm suspicion if you think they might have a peripheral neuropathy, and it can help with staging in terms of severity of disease. It's very useful as a screening tool to identify these folks in clinical practice. We know that the sural nerve function is associated with glycemic control, meaning blood sugar control. And this also translates into arterial sclerosis in patients with diabetes. So the results of this testing could mean early initiation of treatment for diabetics. This is so essential for preventing progression of this disease. So let's take a look at this testing now.
Next, we're going to be doing a DPN check, which screens for diabetic peripheral neuropathy, and we have it here with our little machine. So first, I'm going to have the patient comfortable like this, and I'm going to clean the area that we're going to be testing. We're going to test the sural nerve, and I'm going to apply this BioSense pad to my machine. Just like that. And I'm going to put a little bit of gel down for the probes. And this is going to send shocks to the foot for about 10 continuous seconds. So I'm going to turn it on, except for my, and here I go. And then I press the button. In this position, it has to be away from the Achilles tendon right here on the outside. And then it sends shocks continuously for about 10 seconds. And then when you're done, you can take it off and get the reading. And then we just clean the gel off again. Thanks, and that's it.
All right, great. So this is our last demonstration here, and this is a test to try to determine if somebody has any peripheral arterial disease. What we know is that this particular PAD, or peripheral arterial disease, affects about 18 million people in the United States. And these folks have about a 20% increased risk of heart attack, stroke, hospitalization, and death. And the people at risk are typically those that are over age 65, smokers, people with diabetes and kidney disease typically have many of the risk factors associated with PAD, and they're really known to have increased morbidity and mortality. So early detection is critical for mitigating progression of this disease. The ankle brachial index, or the ABI testing, is recommended. This is an affordable test. It's an effective screening tool to evaluate risk. This index provides a measure of the severity of lower extremity arterial disease, and it's really predictive of coronary artery disease, which are those arteries that occur in the heart, and cerebral vascular disease, which are cerebral arteries, or the ones that occur in the brain. At the PCC, we use something called a QuantiFlow, and this is simply a non-invasive, it's a digital device. It's used as a screening tool to measure that ABI for patients that are at risk for PAD. We'll go ahead and watch that now.
So this next test is the QuantiFlow, which we're going to screen for peripheral arterial disease, non-invasive. And I have my little probe here that I'm cleaning. It takes about a couple minutes. So we're going to start right here on this toe and apply it right there. let it run. No talking and no moving for the patients. I like to tell them to take a little nap. So once that one's done, we're gonna go over here to your other toe. Make sure it's on there. And we're gonna come up here to your hand, just like that. And that's all it for the QuantaFlow, and the results are instant and get printed out on a piece of paper.
Great. So as you can see, you know, healthcare is complex, it's unique by nature. We know that it's sometimes based on many microenvironments. It's a spectrum, it's different East Coast to West Coast. We also know that you know, many people are not getting the healthcare that they need and the experience that they want. For example, women, we know women get the most amount of healthcare, but perhaps don't get screenings for breast cancer. So we find that it's so important that we put these systems and structures in place to bring attention to these issues where we can. We want to minimize these gaps. We want to try to close them and really be in strategic alignment with physicians and the providers in order to really just make it better for our patients, to keep them well. Keep them out of the inpatient and move them to the outpatient is also very, very important. So I will.
Yeah, and Dr.
Yeah.
Biondi, if I could just add to that a little bit, kind of just to connect the dots. I think great examples of technology being deployed in the primary care setting that oftentimes aren't available, or you'd have to go out to a specialist to receive, or maybe you wouldn't get that proactive screening. You'd sort of get the test when the symptoms were in place, and you know you were playing catch up with treating things. The part that might not come through in the videos, but is really, I think, the powerful point of integration between what we can do as a health insurance company, and then what we can do in partnering with Vera through the Prominence Care Centers, is we can really integrate. We can share information. We can deliver insights, and that is exactly what we're doing. So when a Prominence member walks through those doors for a visit, the care team at the care center, they actually have an individualized report or printout for that specific patient with the variety of those tests that we just covered, as well as a few others that they're due for, or the diseases that they're at risk for, and that the screenings are recommended. So that's where we get a little bit more fine-tuned. We're trying to make healthcare, you know, we're trying to stay proactive. We're trying to deliver the right care to the right patient at the right time. And I think that sort of integration of data informatics with, you know, having this great variety of point-of-care testing and technology in the center really enables us to do what we were talking about earlier, which is, you know, proactive population health management there.
Absolutely. So thanks so much, everyone, for having us. We want to know if you all have any questions or comments, or kind of hang out here and see if there might be any.
I think you all wowed them with your wisdom.
No, your facilities are fabulous, by the way. They're beautiful, and I think your preventive medicine care is the way to go. And I applaud you for that. Being a senior citizen myself, I want to thank you.
And Lou, when you become a Prominence member, guess where you'll get to go?
Where?
To the Prominence Care Centers.
Oh, of course. Wait until I think November to switch. I'm a member of some other group, and I won't discuss that right now.
Open enrollment, October 15th.
All right. That's coming up.
So thanks for your kind words, Lou.
It is.
It's beautiful. It's, you know, what you've done. I love visually, speaking about visuals, I love the look of it. And the whole mindset of it is fabulous. And the fact that you can do all those tests and actually even provide the drugs for people. There's so many times that the prescription is sent to my pharmacy and I kind of forget, you know, to go get it. And a couple of days goes by and you lose that momentum of care. And I think what you're doing is fabulous. Congratulations.
Thanks, Lou. It does look like we actually got one question in the chat too from our good friend Tim over at Better Business Bureau. Always good to see you, Tim. Tim actually comes and participates at a lot of our member events, so we love getting to see him and love the services that Better Business Bureau provides to scam prevention for seniors in our community and others. But so Tim here asks, are the biometric tests given to every patient or on an as-needed basis?
I'm happy to answer that. Tim, you know, they're really given as needed. They're designed to test patients who are at risk. So it would depend on your medical history and on your, you know, your personal diagnoses. And so that's sort of, those are some of the things that guide who actually gets tested.
Thanks, Dr. Biondi. And we've got another question here too from Dave asking whether we will be opening any more care centers. I feel like that's a good Dominic question.
Yeah, and I'm happy to answer that. You know, actually, we are opening more care centers as we speak. They're just not in Northern Nevada. We're in the, we just cut ribbons down in at a care center down in our South Texas region, Edinburgh, Texas. And we have more care centers that are opening up in the near future down in Las Vegas in Southern Nevada. So I think that highlights kind of the commitment to kind of solving this access problem and filling a niche here. As for Northern Nevada, I don't think there are any on the you know, the immediate plans, but again, we've got a lot on our plate and a lot that we need to manage and that we're accountable to either, you know, our clients as well as to Medicare. And so as we see a need, I think we found that this is a solution to that need.
Thanks, Dominic. And Peter, this is a really great question. And I'm already gonna start planting seeds for you, Dominic. He says, I'm healthy, so I don't go to see a doctor very often. Do you reach out to members if they don't come in after a few years? And I'm thinking that he might wanna know about our perks program.
Yeah, Peter, thanks for that. And, you know, a few things. If you remember, a few slides at the beginning referenced our outreach team. So we do have full-time employees that their job is to work down lists and to call people and remind them of not sick care actually, but well care, healthy care, right? We want you to be seeing your doctor when you are healthy so that you stay that way. And there's plenty of care that you may be due for even as a healthy individual. Cancer screenings at a certain age, annual labs, you know, just that head to toe physical exam is helpful too. So yes, you would be hearing from us. And we have some things that Amy alluded to, like our perks program. We call it our Prominence Perks program. That's a rewards program where we actually will give out gift cards to members for completing the screenings and care services that they're due for. So we know sometimes there's a little barrier to getting that colonoscopy as an example, and we think it's worth putting a little reward out there to make sure that it happens. Lou, that might be more than we incentivize, but yes, that's where we're headed.
Don't talk him out of joining Prominence.
As an example, though, as a very concrete example, every year, all of our Medicare members are eligible to receive a $50 gift card if they complete a 1-hour health assessment, and we do those at the care center.
I'm in.
There you go.
Great. Fantastic.
Great
I don't see any other questions in the chat. So if anybody else has anything, we've got a lot of great people in the room now, and the minds of collective knowledge that far beyond exceeds my reach.
Looks like Lou has one.
What about chiropractic, acupuncture, or other Reiki, things like that? Do you have that as preventive medicine?
You know, some of those modalities are covered. I have to review the specifics. I would say some of that is yes, but not everything. And typically, you know, those are covered as kind of a bonus. You know, the problem with that kind of thing is it may be wonderful. I know a lot of people say, gee, this has worked well for me, doc. And I would never argue with that. But what we know is that there's not a lot of evidence out there to support it. So typically the things that we support in terms of preventative care is what we consider evidence-based. But like I said, you know, certainly I know there have been many people as they say, gee, acupuncture has been incredible and chiropractic has been great. So, so like I said, some of those things, just depending on what they are, some of those modalities are covered.
And Lou, once October 1st runs around, we're going to send you some benefit highlights. Don't you worry.
I'm sure. Send me the gift card first.
Number first.
Okay, wait. What about nutrition and diet? I need help with that.
Well, we can do that too.
Oh yeah, I think Chris can maybe tell us a little bit more about the health coaches at the Prominence Care Centers, because that's one of the things that they certainly help with, weight loss, nutrition. I'm stressed, and how can I manage stress better? Chris, what do our lovely coaches do for us?
Yeah, I mean, exactly. I mean, you know, again, a lot of disease is really tied more to lifestyle than anything else. So, you know, a lot of that work with the coach is really to set goals, to you know, they're not nutritionists, but they can put a plan in place to really talk about what are you trying to accomplish and help you kind of get on a path to get there, right? Making changes in maybe, you know, I want to go for a walk on a consistent basis. I need to manage my stress, you know. And one thing we found with health coaches, we sort of say it's the white coat syndrome, right? Sometimes people don't feel as comfortable speaking to their doctor about certain things. But interestingly, when they go see their health coach, they'll reveal certain things about what they're trying to maybe want to work on that they haven't actually said to their physician. So the nice thing is that it's a safe place where they can talk about things they want to deal with. And I will tell you, through COVID, it has been a big deal, right? I mean, the isolation of COVID, some of the challenges we've had, you know, especially for our seniors, because I think they've been, you know, legitimately concerned about COVID. They've been isolated. They haven't felt comfortable going out. So we've worked, and we do a lot of tele coaching now. So we do a lot of remote connections in order to, and that's been an interesting process, believe me, as Dominic knows, teaching seniors how to engage in telehealth. I mean, it really has been an interesting process, you know, of really trying to engage seniors, but, you know, you've had to do work with them to help them understand do they have a computer, or how do they utilize their phone, and do they have a camera? But I think all of those things have actually really pushed us to look at new ways we engage our membership, and also how do we leverage technology to engage. So it's been an interesting exercise over these last few years, but lifestyle medicine is a critical part of healthcare, and I think something we'll see more and more focus on. Obviously much better to deal with things on the front end than obviously once someone gets sick.
I would just add one other thing, Lou. I want to mention one thing just to piggyback on what Chris was mentioning. We also have community partners that we work with. We have programs that we offer to folks that are interested, or we think that they might be good candidates. Things like help with pain management, non-pharmacologic help with pain management. These are ongoing programs and classes. Oftentimes they're available through, for example, through the Sanford Center. They have grants and they offer these things to our members free of charge. We have chronic disease program management for folks that are diabetic. Perhaps they need some extra help in terms of managing that on a day-to-day basis. Not just, gee, I need my medication, but you know, what do I do on a day-to-day? How do I live with this? How do I go out to dinner and enjoy myself? What do I do if I've got heart disease? How do I manage it during the holidays, for example, when we know there's more food, there's more salt, all these things that can affect you know, your weight and your function, really. So we partner with many different programs in the community to bring those to our members.
So do you take care of kids?
We do. So we really take care of virtually all ages, not necessarily infants, but generally 2 and up. We take care of in the care center. So a lot of our physicians and nurse practitioners are family medicine trained, and by that, a lot of times they will say cradle to grave. So they really can deal from someone who is very young to someone who is very old. So yeah, so we deal with lots of different ages because we have a lot of commercial clients too, like Washoe County, Sparks Nugget Casino, Carson City School District. So there are lots of families that also leverage the care centers. And so, yeah, so we do deal with a lot of kids.
Dave, I think we made it under our hour.
Nicely done. This was great. Right? We really appreciate everybody from the Prominence team being here today. So thank you all again. Really appreciate you taking the time to do this, and incredibly informative. And I had visited the care center when it opened, but I really didn't appreciate all the things you folks did there. So thank you again.
Thank you, Dave.
Thank you.
Thank you so
Everyone.
much.
Thank you, everybody.
Guys.
Have a good night.
Bye.